Hi, friends and neighbors. I'm Carl Swenson, course mentor in diversity, inclusion, and exceptionality, along with Janae Reiser. And today we're going to spend some time talking about characteristics and criteria of persons with disabilities. Now, as you see here, that we're going to talk today about some high incidence disabilities and also some things that we consider to be invisible disabilities. High incidence simply means that we see these particular disabilities more often in the classroom, and invisible means that we don't see any outward sign of a disability. Now, one of those that's considered to be high incidence that we're not going to talk about today is the category of emotional behavioral disorders. And the reason that we're not talking about that today is because we talk about that um, in another video that has to do with behavioral intervention. So for today, let's start with the intellectual disabilities, or what we oftentimes refer to as mental retardation, um, or intellectual disabilities, as you see it here. There are a number of different definitions that we can use for intellectual disability. And one of the most recent is what you see here. The idea that mental retardation is replaced by a more contemporary label. The idea of politically correct, and also we want to begin to use terms that are more meaningful in the field of special education. So the definition that you see here: a disability characterized by significant limitations in both intellectual functioning and adaptive behavior. This disability typically originates before the age of 18. That separates it from a series of other disabilities such as traumatic brain injury and things like that. We said that one of the things that we see significant limitations in is adaptive behaviors. And so when we're looking at adaptive behaviors, we need to have some idea of what we're talking about with that. Now, adaptive behaviors oftentimes are things that we would consider to be life skills. Being able to tie one's shoes, being able to button one's shirt, or zip up one's pants, or maybe making a peanut butter and jelly sandwich. Those things are considered to be life skills, and so we oftentimes, when we see a person with intellectual disabilities, we often see a significant limitation in these adaptive behaviors or life skills. Now, when we're talking about the idea of intellectual disability, we also are looking at cognitive disability or cognitive difference, and it's important to understand the idea of intelligence quotient, or IQ, as it relates to this particular disability. If we look at everybody who's ever taken an IQ test, the average IQ for all of those people is right here at 100. Now, when we look at the breadth of folks who have taken an IQ test, 95% of the people 95% of the people fall in an area between an IQ of 70 and an IQ of 130. That's 95% of the population that have taken IQ tests sometime in their lifetime. So, what do we consider to be an intellectual disability? Well, typically it's an IQ of less than 70. So what we're talking about is 2% of the population having an IQ of between 55 and 70, and then 0.1% of the population having an IQ below 55. So these people, this 2.1% of the people that are on this end of the bell curve for IQ score distribution, are people that we would consider as having an intellectual disability. Okay, now um, this has been what we've used in the past for categorizing different levels of disability in intellectual disabilities. We consider the IQ of 55 to 70 to be mild mental retardation or mild intellectual disability, and then 40 to 55 is moderate. 25 to 40 is severe retardation, and actually we cannot score an IQ of less than 25. We don't know how to do that. We don't have the ability to do that with the tests that we have. So we're looking at different categories here of how we might classify those people. Now, when we're assessing adaptive behavior, when we're trying to take a look at that, um, we have to draw on assessment tools that are developed by different organizations. And the American Association for the Mentally Retarded, the AAMR, they have created a couple of behavior scales that we can use or that we are using in schools to identify limitations in these adaptive behaviors. So you may see that someone in your school is using these scales, these AAMR scales. Typically, it would be a counselor or maybe the educational psychologist would be using those scales in an attempt to determine what level of adaptive behaviors we have. Now, as we look at a little bit more information on these students that we have with intellectual disabilities, we kind of wonder, well, where did all of this come from? So we look at the etological perspective. Is it biological? Is it environmental? Sometimes we can look at one or the other and kind of get a pretty good feel for it. One of the things that we want to be careful with in the educational environment is we want to make sure that we don't use a lot of outdated terms, and that's why we're struggling so much to come up with this with a universal usage of the idea of intellectual disabilities as opposed to mentally retarded. Mentally retarded carries with it a stigma. The term retarded has a stigma that is often difficult for folks to work with, and so we want to do a better job of that. We want to make sure that we are using our correct term. Another thing that we've started to do here recently, and it's really making a big difference in how we support folks with intellectual disabilities, is that we've begun to look more at the level of intensity of support than to look at the level of IQ. Now, you remember that slide that I showed you that had mild, moderate, severe, and profound intellectual disabilities. Well, that's how we used to categorize folks for support and related services. But now we're looking much more. We're focusing much more on the idea of how much support does a person need, and that tends to provide a better system of support and related services for people with intellectual disabilities. So we're now saying that if a person needs intermittent support, that would probably relate to that old idea of mild mental retardation. So here's a person who needs support occasionally. This might be in the classroom, might be in adaptive behaviors, but it's still only an intermittent need for support. And then we move to limited and extensive, and then finally pervasive. Pervasive is the person who needs support 24 hours a day and 7 days a week. So this is kind of what we're looking at when we're looking at intellectual disabilities. Now what I'd like to do is to move to the largest category that we have in disabilities, and that is the learning disabilities. Um, of all of the folks that are in special education who have been identified as having special needs, about 41% of them uh, have a learning disability. This is the largest single category of disabilities that we have, and you can see that we're really dealing with a lot of students here at 2.4 million. Now that figure too was some time ago, so we kind of have to realize that that's even a little bit more now. When we're defining learning disabilities, we have to think about these things that a student or a child has a mismatch in an expected ability level and actual ability level. So we expect a certain achievement at a certain age, but this child who has a learning disability has reached the age but not the ability level. So there's that discrepancy between achievement and potential, and that's what cues us in to a learning disorder. And it can be in any of these areas, and you see that they all have to do with being in the classroom. You know, sometimes learning disorder is called the 7-hour disability, and that's for the 7 hours that the student is in class. There appears to be a disability during those 7 hours, but during the rest of that student's time, when he's not in school, there's no disability that's present or discernible. So it only occurs when we're in the learning situation. And most often we see it with these things that are listed: the oral expression, written expression, reading skills, and math skills. And if you want to see a really good description of learning disabilities, go to the bottom of this slide and you'll see that there's it says watch this animated video to see a description of learning disabilities, and you can click on that and it's a hot link and it'll take you right to that. Then you can return to this slideshow. All right, these are some of the components that we see in learning disabilities. Intellectual functioning is normal, or usually within normal ranges, which means that the IQ of the student is usually average or above average. But we do have this significant gap between potential and actual achievement. So we expect a person in the third grade to be able to read at the third grade level, but someone who has a learning disorder that affects reading may only be able to read at the first grade level. But math or written work might be just fine, might be at grade level, but the reading is not. So this is compounded by a learning disorder. And we also see that we have difficulty in learning in one or more academic areas, and there's some presumption that it's a central nervous system dysfunction. We're not really sure yet in a lot of cases what we have for the etiology of learning disorders, but we're working on that. Okay, so the prevalence of learning disabilities are pretty high, as I mentioned before. Depending on which research you're looking at, those range estimates can go from 1 to 30% of the school population. This 2.52 million students ages 6 to 21. That's what the federal government is thinking these days. However, I tend to think that it might be a little higher than that personally. Some of the characteristics that we see with students who have learning disabilities, we have oftentimes we'll find that the fine motor skills are not real proficient. We have some inability to attend to the projects at hand or to what's going on at hand. We sometimes have problems with expressive language, which is the language that we speak, but we also have problems with receptive language, which is the language that we hear. We also see that there are some quantitative disorders within math. We find something that we refer to as dyscalculia, which is a problem with calculating in math. We're unable to do some of those things. And then as a result of some of these learning disorders, we also see that there are some social skills deficits. Some of the things that we have difficulty with in language, specifically in language, are these things. We have problems with comprehension, decoding, word recognition, and phonological awareness. And then, of course, you've all probably heard of dyslexia. You know that that might be. Um, it's often indicated, or it's often shown in movies and on TV as writing that's upside down or backwards, but that's not always the case. It could be very simply that nothing is on the same line. It's all jumbled up and very difficult to follow. And so oftentimes with this, we also see problems with spelling and with writing. It's very difficult to put their thoughts down on paper. And organizing thoughts into words is a very, very difficult situation for a lot of kids with learning disorders. And at the bottom of the screen is another really good little flick about dyslexia, and it'll give you a little bit more information about that. Now, I said that there were some problems with math, and there are indeed. So I'd like to kind of take a look at some of those and just make you aware of what you might run into in the area of math difficulties with the learning disorder. A lot of times they have really significant problems with word problems. They have a great deal of difficulty in determining what it is that we're looking for in a word problem. So sometimes it'll be necessary to do a lot of that, work with them on that. Spatial relationships, understanding, how things fit into a particular space, or how things fit into the confines of another thing. They often have difficulty in copying shapes. We used to, in teacher education, we used to create a situation for teacher candidates to give them a feel of what it was like to have this dyslexia, or this difficulty with math and dyscalculia. And what we do is we'd put a figure on the table, and then we put a mirror so that the teacher candidate would have to look into the mirror, and then we'd ask the teacher candidate to trace the drawing while looking in the mirror, and it's very, very difficult because your hand wants to go one way and your mind is saying go another way, and oftentimes you get terribly confused in the drawing. And another short little video at the bottom of this one about dyscalculia. It'll give you some pretty good information as to just what we're talking about with dyscalculia. Social and emotional difficulties that often run hand in hand with learning disorders are these. Because students have difficulty in school, they often develop a lower self-esteem, or they have a very poor self-concept of themselves. They become very frustrated in the classroom. It's hard for them. They don't understand why everybody else can do the work, or they don't understand why in this particular class they're having so much trouble. As we're looking at kids with learning disorders, you can see that we do have some work to do there. Now we're going to kind of switch gears, and we're going to move into a third invisible category, and that is attention deficit hyperactivity disorder. Now, to this point, we've been talking about disabilities that have categories of their own. I mean, we have a category for emotional disability, or I'm sorry, for intellectual disability. We have a category for specific learning disorders, but we don't have a category for ADHD. So oftentimes, schools will place a child within the category of other health impairments, or OHI, for special education. We also see some kids placed on a Section 504 plan, Section 504 of the um, Rehabilitation Act, 1973. That's often used for kids with ADHD. There are 4 different diagnoses with ADHD. There's ADD, which is attention deficit disorder. There's ADHD, attention deficit hyperactivity disorder, hyperactivity. There's ADHD impulsivity. And then there is a combined category of ADHD, hyperactivity, and impulsivity. So basically, we have 4 different categories of ADHD. The American Psychiatric Association in the year 2000, defined it as a persistent pattern of inattention and or hyperactive impulsivity that's frequent and severe. And as such, oftentimes we find that a lot of kids who are identified with ADHD, there's a misconception that we think that they don't pay attention to anything, when in actuality, they pay attention to everything. And they get this sensory overload because they pay attention to everything, and they can't really keep up with it. And as a result, then they have a tendency to fall behind. So when we're diagnosing ADHD, this table actually comes from it's an adaptation of a table that comes from the Diagnostic and Statistical Manual. The one that's used, the DSM-4, the one that's used by child psychiatrists and by psychologists to determine some psychiatric or emotional disabilities. Anyway, what we're looking at here, as you see, it says that we have 6 or more of the following symptoms of inattention or hyperactivity and impulsivity that persist for at least 6 months. To a degree that's maladaptive and inconsistent with developmental level. Okay, that means that it takes away from their abilities to do their job. So when we're looking at these, we have to add up and make sure that we have at least 6. So some of you who are parents and have kids, as you look down this list, you're going to say, wow, I see a lot of this in my kids. Well, yeah, that might be true, but we have to look very closely at the list, and then also at the child, to make sure that that things are that we're looking at the right things. There are a number of studies that are ongoing now and have been ongoing for some time about ADHD and how many kids actually have ADHD. The latest thing that we're seeing is about 5% of school-age children have ADHD. However, the most recent research might indicate that it's higher than this, but it's important to realize that we do have a lot of ADHD going on. Etiologies, what causes it? Well, we're not really sure, but these are some of the ideas that there might be some sort of a neurological dysfunction, or there might be something that's hereditary here. These twin studies are pretty cool. What they do is they have found sets of twins that were separated at birth and grew up apart from each other. And so, the environmental factors are really pretty different. So they're able to study these twins who grew up apart from each other and see if there's any connection. And they have found that there seems to be some hereditary connection through the use of those twin studies. Now, a lot of what we see, the characteristics of what we see with ADHD, ADD, and ADHD are things that are on this table. Um, and of course, this is a lot of it. Now, when you look at the hyperactivity, you see a lot of excess movement, you see a lot of restlessness, you see the things that you might expect with hyperactivity. When you look at the impulsivity, it often goes together with the hyperactivity. And now we're looking at things that have more to do with blurting out or acting out or having a great deal of difficulty in waiting one's turn. Now go to the far left side and you see the inattention characteristics. And you know, as I said before, a lot of times it's not that they're not paying attention to anything. It's oftentimes that they're paying attention to too many things. And as a result, they don't finish tasks, or they have trouble organizing, or it seems like they're not paying attention. So, um, and we also find that we have some social and behavioral issues as a result of ADHD. And it all mostly has to do with self-regulation, the inability to self-regulate oneself, to hold to hold oneself down, and to create, to not create, but to pay attention to what's going on, and to do what one is supposed to in class. That's a very difficult thing for kids with ADHD, and as a result, a lot of them have social and behavioral issues in class. Please note in the bottom statement on this slide, because it's significant and it's very important, that comorbidity of ADHD with another disability is very significant. And again, we don't know why this is the case, but frequently, and when we say frequently, we're talking about more than 50% of the time, the ADHD coexists with another disability. One of the 12 disabilities that fits into our categories. So it's really a difficult thing to work with, but it's something that we have to pay attention to. So if you have a student that you believe has ADHD, make sure that you look for something else along with that. And so with that, we're going to close for this morning, or for today. And we've only talked about 3 of the invisible disabilities, but as I said before, we talk about emotion behavioral disorders in the EBD, or I'm sorry, in another section in behavioral intervention. So we'll come back and talk about that one later. Thanks very much for your time, and I will see you again on another time.